Hello everybody, this is Dr. Aaron Seaton with the Chiropractic Place. Today's video is about chiropractic and a course of care. A lot of the times when we go to healthcare providers of any kind, we chart a course, so to speak. We lay out a game plan to help our patient get to reach the goals that we've set out from the get-go. And I wanted to kind of discuss that with patients because sometimes people perceive chiropractic care as this thing that we're going to go do one time, and then when I get off the table I'm supposed to magically feel better and everything's supposed to be gone, and if that doesn't happen then I'm going to try something else. So I like to just kind of go through this with people to kind of reiterate to them why it's important to follow a course of care when you're with a chiropractor. So number one, if we go to physical therapy for a problem, and I refer patients to physical therapy all the time, the usual standard protocol is to follow something like twice a week, anywhere for 4 to 6 weeks, to make sure that we are charting a course of care to see if we can help that patient get better and see if physical therapy can provide them various exercises, modalities, and stretches that can help that improve. And in many cases, when we're seeing those improvements, another 4 to 6 weeks may be authorized to get that patient even further improved. And even after that, a lot of the times physical therapists have ongoing recommendations to their patients, whether it be stretches or exercises that they want them to do on a continual basis to prevent that problem from coming back. So that's true with physical therapy. Most people, when they go to a physical therapist, understand if they go there one time, you're not going to get results doing that. Number two, if we go to our dentist, when we go to the dentist, most of us understand, if we're going there and we haven't been in a while, that there might be a course of care charted by our dentist as far as possible deep cleanings. If there's any cavities that are spotted, the dentist may want to repair those now. And then even after any corrections, dental corrections are made to problems that they found, your dentist is going to chart a course of care for you, which typically includes, hey, I need you to brush and floss twice a day. We need to be seeing you anywhere from every 3 months to every 6 months for regular cleanings as a preventative maintenance of your dental health so that we do not incur big problems down the road. Most people, when they go to the dentist, they fully understand there is a course of care, and more importantly, there is regular maintenance required if they want to maximize their dental health. Chiropractic care is no different. If you've never been to the chiropractor or you haven't been in years, what we do in our office is we provide a consultation and exam. We take digital x-rays in the office so that we can better understand your spine. Very similar to if you went to the dentist, hadn't been in years. They're going to take digital x-rays of your teeth and your jaw to see what is going on in there. Is there anything underlying under the surface that we need to address? Similar in chiropractic care, we're taking x-rays to better understand your spinal health so that we can make better clinical decisions regarding your course of care. Now, most of my patients, we're starting off somewhere in the 2 to 3 times a week for a few weeks to a month to see, is our approach working? Are we getting are we achieving the goals that we set out? Are there any adjustments that we need to make to that care plan as we move on? And typically with patients, we see that go less and less. But what we're trying to do with chiropractic care is no different than what your physical therapist is trying to do or your dentist in their respective fields. We are trying to achieve results, and we need time to make those changes. So if you've been to the chiropractor, you've only been once or twice, and you didn't quite get the response you were hoping for, that is probably why. And this is why we spend that time on the first visit to better understand what your needs are, so when we're providing chiropractic care for low back pain or neck pain or headaches, whatever it is, that you understand what we're doing and why we're doing it that way, because it takes time to make those changes. And then after we achieve the results our patients are looking for, we're typically going to have a preventative maintenance recommendation because it's a lot easier if we take care of your spine along the way rather than wait for you to have things wear out and then try to get rid of pain. That would not make sense for your dentist. If your dentist said, oh, well, I fixed your cavity, I'll see you in a couple of years when you get another one, you don't need to really do anything. That would make no sense to all of us. The same is true with chiropractic care. There is regular ongoing maintenance that is required if you want to maximize your spinal health. I'm Dr. Aaron Seaton with the Chiropractic Place.